Today, I formally announce that a Royal Commission into Defence and Veteran Suicide will be undertaken following approval by the Governor-General earlier today. We recognise as a government, and I think as all Australians, the contribution and sacrifice of the men and women who have served our country. And the death of any Australian Defence Force member or veteran is a terrible tragedy that is deeply felt by all Australians, but particularly those who served alongside them and their families. As a government, we are committed to addressing the ongoing impact of service. And that view is shared not just by my ministers, but it is shared in particular by those who lead our defence forces and are involved in all the agencies of government. I believe at both a federal level and at a state level, doing all we can to support our veterans as they struggle with the demands of their service. The death of any veteran is a great tragedy, and we remain committed to addressing that. The ongoing impact of service, including preventing future deaths by suicide and providing opportunities for healing. The inquiry will be led by Mr Nick Kaldas, APM, former Deputy Commissioner of the New South Wales Police Force, where he commanded around 14,000 staff members and a budget of more than $2 billion. Mr Kaldas has extensive international experience in law enforcement and peacekeeping, including as Director of Internal Oversight Services for the United Nations Relief and Works Agency and as Chief of Investigations for the United Nations Organisation for the Prohibition of Chemical Weapons in Syria. Mr Kaldas will be supported by the Honourable James Douglas, QC, an esteemed former judge of the Supreme Court of Queensland and respected member of the legal community, and Dr Peggy Brown, AO, a consultant psychiatrist and national leader in mental health policy with extensive experience in health and mental health service planning, governance and administration. The Royal Commission will inquire into systemic issues and common themes related to defence and veteran death by suicide, including the possible contribution of pre-service, transition, separation and post-service issues, and other matters believed by the Royal Commission to be relevant to its inquiry, which is in the normal practice in these types of Royal Commissions. The Royal Commission will be able to inquire into any previous death by suicide, including suspected suicide. It will be conducted independently of government, including the Departments of Defence and Veterans Affairs. In making recommendations on systemic issues, the Royal Commission will be informed by the individual experience of defence members, veterans and their families and support networks. The Royal Commission will conduct its inquiries in a trauma-informed way, and private sessions will be available to those who wish to share their story in private. Legal financial assistance scheme will be available to people called as witnesses to the Royal Commission. An independent legal advisory service, counselling and support services will also be made available to people engaging with the Royal Commission. The terms of reference has been informed by feedback received during an extensive public consultation process, including with views provided specifically by states and territories who join with letters patent. Over 3,000 submissions were received during the consultation on the themes for this Royal Commission. The National Commissioner for Defence and Veteran Suicide Prevention Bill, currently before the Parliament, will be amended to ensure that the National Commissioner will complement and not duplicate the Royal Commission's important work. The National Commissioner will be the permanent body responsible for implementing the Royal Commission's recommendations, and these landmark measures will together reduce deaths by suicide of defence members and veterans. The Royal Commission is due to provide an interim report on the 11th of August 2022 and a final report on the 15th of June 2023. But as is always the case with Royal Commissions, we will work closely with the Commissioners to ensure that the Royal Commission is undertaken comprehensively and extensively. And for further information, including terms of reference and information, that is available at the website. The Australian Government is committed to supporting the health and well-being of those who have served in our defence forces. Some $11.7 billion in federal funds supports more than 325,000 veterans and their families each and every year. I do want to encourage media to report the other services that are online. For announcements like this, I know will have an impact on individual veterans and their families. and those services, whether by Lifeline, Open Arms, the ADF Mental Health All Hours Support Services, the Safe Support Zone, all of these numbers, and I particularly refer to the Lifeline number of 13114, 13 11 14, and also for Safe Zone support 1800 142 072. I want to thank all of those who participated in bringing this terms of reference together. It's now time for Commissioner Kaldas and his fellow commissioners to get on with that job of that commission, and I look forward to receiving their report in the future, in particular their interim report.